Hello, everyone. Welcome back to the BioNexus Health Podcast series. Today, we will be speaking with Bob from Arizona, and we'll be diving deep into his journey with Lyme disease, multiple co-infections, mold exposure, biotoxin illness. Bob has had a really rough time with all of the above, but there was definitely light at the end of the tunnel, and he is doing much, much better now. It is best to hear it straight from the horse's mouth, right? So let's head over to Bob. Bob is in Arizona, as I mentioned, and I shall welcome Bob to the podcast.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Dashore.
Hey, Bob, welcome to today's podcast.
Hello, how are you?
I'm doing well. How are you? How's Arizona?
Good. It's hot. I'm glad to be inside today. I think it's 108 outside right now. So.
Oh, no way.
Yeah, no, it's really hot.
Oh, goodness. Well, here we had a pleasant braising 85.
I'll take that. Happily take that.
Yeah. Well, it's absolutely wonderful to see you healthy and smiling, in good spirits.
Thank you.
Shall we take, a slight journey into the past when I first met you? Like, how did you decide that you wanted to, go for plant-based natural medicine options? Because I remember when I first met you, you came to my office looking extremely debilitated.
Yes, looking and being extremely debilitated. Yeah, I mean, by the time I came to your office, I had been sick for several years with no real explanation as to what was going on. I'd kind of been down the functional medicine path of, so I kind of had already veered off of kind of some of the standard traditional medicine in this country. And that definitely helped me feel somewhat better. By the time I got to you, I had kind of fallen off a cliff and I was looking for something definitely different. I had kind of been given some vague information that perhaps I had Lyme disease and perhaps mold was affecting me. And, there wasn't anything that traditional medicine was going to do to really assist me in either of these things. And I knew for sure I didn't want to go down a path of, years of antibiotics or anything like that. I had already had tons of stomach problems already, and, gone through multiple rounds of antibiotics and things for that, which I feel like just made things worse. So I wanted very desperately to find something that wasn't going to make me worse and wasn't going to give me some kind of long-term problem in order for a little bit of maybe feeling better in the short term. So I think my wife actually found your website initially and said, hey, she just kind of gave me a list of people to look into, and I liked what I saw. It just seemed more natural. And, as I've said to you, like, this was like the end of the line for me. I had tried so many other things. And, I was going to be very committed to whatever my next step was. I didn't know where else to turn afterwards. So I liked the idea of doing something that was natural and seemed to make sense to me.
So you were very symptomatic with the gastrointestinal issues, your gut. You had many symptoms with your gut. You had been given medications for those gut issues, but never any official deep dive into Lyme disease or mold biotoxin illness.
No, Lyme. Well, a couple of years prior to seeing you, my house had some mold issues, and my functional medicine doctor, suggested that mold might be an issue, but that wasn't really his area of expertise. I did see somebody who was a mold doctor, and he scared the heck out of me, and it wasn't an experience that I was ever going to redo again. So,
oh goodness.
I sort of, after that, I was eating extremely clean. I was exercising all the time. So I kind of was able to sort of will myself back into some level of health. But I continued to have ongoing issues. I guess the problem was it took so much effort for me to be okay, that, getting back to feeling good was, that was sort of off the table. It was like, if I never eat gluten, and if I never eat dairy, and I don't eat any carbs, and I'm, drinking tons of water every day, and I exercise, and the amount of things that I would have to do just to be okay. So I kind of had some ideas that there was something, mold related that might be an issue for me, but I never really pursued it fully. And then the Lyme, I guess I was positive for like 4 bands, and so every doctor's like, "Nah, you're clear. You don't have Lyme disease."
You don't have Lyme, right? Because you were not CDC positive,
Right.
So there's that conflict. Yeah, I mean, after all these years into Lyme disease research, it's a shame that there's still that dichotomy, that conflict that exists amongst these two branches of, thought processes. You staggered into my office, staggered back out.
You're giving me too much credit. I don't even think I was able to stagger.
Wow. Yeah, but and then after that, it's been it's been such a pleasure knowing you, because you've been the most diligent, the most compliant of of the thousands of patients I have around the world. I'm like, hey, we have to do a podcast with Bob, just for that inspirational piece per se, that, hey, it's just absolutely amazing how you did. The one thing that I would like you to touch upon for sure is your very high levels of sensitivity, right? Your mast cell issues, your sensitivity, that you had to very slowly progress with all of the supplements and the herbal medicines. But, what kind of kept you motivated was that you were seeing steady progress as well. So if you could, please.
Yeah. I didn't pay that close attention when you first gave me the instructions, which were to go very slowly. And I actually tried initially. I said, oh, I'm going to start with a couple of drops of this and a couple of drops of that, partially because mentally it's a lot. The treatment is a lot. So you just kind of want to like fast forward and get to somewhere.
True.
Very quickly, I realized that wasn't going to be great, that I probably should actually listen to what you put in the instructions, which were to move very slowly. And there were certain, even with that, adding a drop of each one of the, like each day add one drop of one of the herbals. And, even with that, there were certain ones that I could tell, like, oh, I knew the V blend, once I got to V blend, every time I increased it, I always felt a little bit like something's going on. Something's going on today with this one. But, at the beginning, you're just so desperate for some kind of improvement.
Right.
And like, I just want today to feel better, and I don't feel better. And then all of a sudden it was 2 months later, and I'm like, well, actually, I don't feel so bad. I'm not sure when it happened, but, it definitely, once you start seeing that progress, then you say, okay, this is how I feel. And I'm still only, a third of the way to where my, the levels of the herbal should be, and what my program should be at. So, I think that really gives you, when you are able to look back and see, oh, at this beginning, I could barely work. I was like, couldn't move and I could barely think straight. But a month later, I was going to meetings in some place and I was running 5Ks. So I guess I felt better, but it's hard to identify what day it happened, but but you get there.
Right.
You just got to be patient.
When you mentioned something is going on with the virus blend, to those listening and watching, I just want to specify what Bob is speaking of is a die-off reaction. So when herbal formula or herbal medicine is targeted, for example, let's go with what Bob mentioned is the V blend or the virus blend, and if you have a pretty high load of viruses, when those start to die off, even small amounts of herbals, couple drops of herbals can be enough to cause a Herxheimer or a die-off reaction. And clearly, that doesn't feel pleasant, and hence the request for going slow, like adding in 1 drop every few days. And so, Bob, not to feel too bad, because many people try to fast track, especially, people like yourself who've been through so much already.
Yeah. And
you're like, okay, here's another approach, another regimen that I'm going to, try and see if it works. And I want to really know if it's going to work. I don't want to be wasting my time anymore, etc. So let me just, fast track a little bit. But right. I understand.
Yeah, I mean, and that's been a little bit of my way of dealing with being sick. And I've mentioned to you, numerous times that I've tried to exercise all through this, and almost that's one of the things where I'm just like, if I feel sick, I'm gonna like go for a run, and I'm gonna do all these things, and I'm gonna try to like push through it. Well, you can't. It's not always the best idea to just push through something. And I think that was initially I was, well, it says to go slow, but if I just really hammer it, for the first couple of days, I'll get there quicker. But that's clearly not. I mean, there's a reason why to go slow, because you'll still, there will still be, days where you feel like, wow, I'm making a difference. I'm doing something. I can feel something happening. And the nice part is usually a couple of days after that, you feel a little bit better.
Yes, yeah. Your baseline shifts, so that you just went through a die-off reaction when you actually feel better than before you started that herbal formula.
Yep.
So Bob, you felt really good. You moved from New Jersey all the way to Arizona with your beautiful big family, dogs and all.
Yes.
And right, and you did so well. And then at one point you kind of fell off the wagon, and then you recently got back on. Can you talk a little bit about that?
Yeah. After having been on the program for a year and a half, I was doing some traveling, and I had brought some of the stuff with me, and then I was going to order some more, and then I was like, well, let me just, I'm not going to worry about it for this month, and I kind of fell off the wagon a little bit, and I felt okay for a little while. And again, doing it when I'm traveling, of course, I'm staying in hotels and doing all kinds of stuff. So who knows what I might be being exposed to. And I don't feel like I ever really got myself all the way to where I needed to get to.
Right.
So I definitely fell off the wagon, and prematurely. And I ended up feeling pretty bad before I got back on the protocol. And I think for me, it really drove home what this did for me. When I came to see you the first time, I was having so many struggles. So there was, I was on other medications and things like that. And sometimes you say, well, wait, was it this or was it this? Like, what really helped me here? Well, having gone through it the second time, I can say definitively this is what helped me. Because, shortly after going back on the protocol, I feel very well again. So, it's clear, you never want to be the person who's sick and who, has to kind of address these issues and has to address them in some ongoing way. But ultimately, accepting that and realizing, okay, this is where I'm at right now. This is what I need to do to make myself feel better right now, to get myself to a healthier place. And then instead of just dropping off the protocol, then you kind of determine how do we best go forward maintaining that place, obviously is a better path for me, as I've now confirmed.
So, one thing that you recently mentioned to me that I found very interesting was you actually had an opportunity to feel the innate intelligence of your body, how your body adapted to the herbals, because when you went back on the full herbal protocol, you did not have to increase the dosage like one drop at a time. I believe you said, you were able to add drops more liberally this time.
Yeah, when I restarted the protocol, I did start pretty slowly for the first couple of weeks.
Mm-hmm.
And then I wasn't having as much of a problem with the die-offs as I was previously. And then I started, at one point, I was moving very fast. Because I did feel like, especially kind of recommitting to the protocol, I wanted to get to, I think for the first time, I never really fully reached the number of drops for all of the things. And this time I just said, you know what, I'm just going to fully commit to it. I'm getting to each one of these herbals. I'm getting to the number of drops. That's the recommended number. And, once I saw that I was able to kind of go a little bit faster, I was, I was moving. But it's definitely, as you say, the kind of thing where I already knew since like V-blend last time was something, I was like, oh, I'm definitely not adding more than one drop of that in a day, but something else that that previously I hadn't really had any, die-off reaction issues with. I would give it a little bit more, add a couple in the morning, a couple in the afternoon, a couple in the evening. So, yeah, it's just how you can kind of go by how your body feels, and, you'll know if something's happening.
Yes, one thing that most people definitely gain is an intuitive understanding of their own body's reactions. And, I like the fact that you mentioned that you were on the protocol, for a significant amount of time. It did take time to build up your herbal protocol, but you were on it, at least, 14 to 18 months before you decided to take a mini sojourn, just a little break. But what happens is that people that I see in my office very often are in similar situations like you were, going from pillar to post from one physician to another, treating symptomatically and trying different methodologies, that it often takes them a couple years to find me before they find myself. And then, I try to remind them, now we are going to be addressing everything. We're doing lab work, look deep into what's going on with your body, toxins, infections, exposures, environmental issues. Give yourself a couple years.
Yeah.
Yes, right? Because this is the first time you'll be doing things the way they were supposed to be done, in the right order, and completely plant-based. So, it will take a little bit longer, but you will see lasting results.
Yeah.
So that's something to keep in mind. All right, wonderful. I know you're still at work. We have a 3-hour time difference between us, right? Time zones. So I really appreciate you coming, hopping on the podcast for me today in the middle of the workday.
Of course. This is more fun than work, right?
To me, it is.
Wait, to you, it is work.
For me, it's the end of my workday here, and for you, it's the middle, right? So, well, enjoy the rest of your day.
Okay, thank you.
All right, take good care, and I'm sure I'll speak to you soon.
All right, sounds good. Thanks a lot.
Okay, well, so that was Bob from Arizona. He had to hop off, he had another Zoom meeting to attend to. So, I let him go. Wonderful. It's so wonderful to see him fully functional, working full days. He has a big family and absolute wonderful dad and husband. So God bless. Anyway, so that's the podcast for today. Thank you for joining me. As always, be well and namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.